Good morning. This is Dr. Bill White again with the American Orthodontic Society, and I want to talk about a problem that comes up is handicapped patients, and from time to time you'll be called on to work on some of the handicapped patients. I kept records on this one. It was a real bell ringer, and it was a very difficult case and didn't get any easier. The young lady that I worked on was perfectly nice in the office. When she came in, she didn't create any problem or anything for us, but when she wasn't in the office, she got in trouble, all kinds of trouble, and they had finally kept her in a detention place in Gainesville, Texas, and somebody would bring her in when her appointments were, and finally they transferred her out before I got through, but I'll show you what we accomplished before she left. I never was able to bring the vertical height of the lower third of the face down, though. So let's get on with it. She just continued to breathe through her mouth all the time, and her mouth was open, and just an excessive amount of space, between the nose and the chin down here. You would like it to be much shorter, and she just kept her mouth open and her teeth erupted together, and it even got worse as we went along. I never could convince her to do the things that I wanted to do. So let's kind of run through this. This is a nightmare orthodontic case to start with, and it's extremely crowded, and the cuspid's up here, and of course she doesn't brush her teeth good. I think that people were taking care of her hip some in that area. We didn't seem to have a lot of decalcification, but the gum tissue would get inflamed around the teeth, you see, and get this so much bacteria in there that the body wasn't immune to, and we had trouble with that, but not a great. That wasn't our main problem. And the palate, where she breathed through the mouth all the time, was just absolutely so narrow in here. It widened out back here. The tongue, I think, kept darting through here, but it was on the lower arch. So we knew we had to take out teeth. So we took the first bicuspid teeth out first, and I tried to go along with that. And finally, we just gave up and took the next bicuspid teeth, the second. So all four bicuspids we removed, and it's still way too full. It's just, oh, well, you'll have to look at it to see. And the bottom was crowded, and she wasn't brushing there either. We put, this was back in 75, and we must have been working on her since 74 or something like that. I don't have the dates that I remember seeing up there. But anyway, we got the lower and we're straightening it out, and the upper, is fitting inside the lower. So we had to set up a palatal separator in her case, and we went ahead and did it, and were able to work with it. I mean, this is a job just getting this in the mouth, you see. And we'll open it about as wide as it'll go, trying to make some room. And we did widen the palate out. Now, this was back when we didn't wear gloves, so this is not something that we did today. But we put the palate separator, and this is what I would like to use the palate separator today. I like to band the cases and have those teeth just rigid in there, so when you go apart with it, you carry the roots of the teeth apart with it. You'll kind of tilt it first, and then you sit there, it'll come back out, and you gain airway. You get the airway back, and then you take it out and get the tongue to going up in there, and you try to get them functioning right where the tongue, every time you swallow, your tongue would push out on that, and that's the way the torque gets in anybody's mouth properly. So anyway, we put this palatal separator in, and we're getting the lower arch to look fairly good. We've got a little flexible wire in there, and you see we're wiring this down. It'll pull that cuspid over that side and rotate it this one too. And just regular orthodontics is pitched in with all this. Now, we haven't tried to get on the upper teeth first. We open this up with a palatal separator. Excuse me. Okay, I'll go kind of fast here, and we'll show this. I hate to take up so much time on something I'm sure you'll never use this, or you probably never have anybody like this young lady, but anyway, the palatal separator worked. Now, I would like for you to notice that we had a separator on the first and second bicuspids up above. You see, we were on this tooth and this tooth. We cut this thing off somewhere in here and took out these bicuspid teeth after you separated. By the way, separate first and then extract. So that's a pretty good rule to follow. Then we get back up here where we have it out. We took this thing off, and then we took those teeth out. And now your palatal separator is just on the 6-year molars and the bicuspids. And then we'll have to, round this arch out like this. It's a real challenge to work on some of these people like this. Now the bottom is lining up pretty good, and we don't need all this space, but the vertical height of the face is so bad that we felt like we had to eliminate some more and get some more space and have her close on fewer teeth. And we have to jump the crossbite on that. There's a lot of challenging orthodontic procedures in here. We made some little hooks. We just made them and bonded them up to the, and we'll pull these cuspids down in. This was 1975 right here. So we're wearing elastic off of here and pulling this down, you see. Now that pulls the lower jaw forward a little bit too. It has a problem with that. And you can see the little hooks we made out of wire and put on those teeth. Those work fine. That was back before we had a lot of things that you see today. It was certainly before the brackets were out, but we hadn't changed completely over yet. Now we'll open up space and get the cuspids in there. And so we got it looking halfway decent. And I think she's brushing a little better. It looks like her gum tissue's healing, but she's still got some spots where the gum tissue is very irritated. But that's getting better. And so when you look at the facial structure, though, you'll see, wow. So we're coming around pretty good in here. And now the fullness of the face and the height of this in here, we wanted to reduce this some. and bring this back in a little more. So we took the other bicuspids out. On one of the cases we took 6-year molars, but this one we took the bicuspids. And there's a lot of excess length in here, like the face would be a lot better if we could get her functioning right. And but I don't think we ever really got to the young lady, and she was in this detention home in Gainesville, and they brought her in, and we came back and here and took the other bicuspids out. Now that might seem a little hard, so we took them out and gave us a little more room. Now they pull the cuspids back against the molars. That's the only problem. We were closing this space right in there. And here in 1978, in other words, we've been working on this girl for years trying to get this. You see the inflammation around the gum tissue. I've had that before, you see, like that. We could have done a pretty good job, but she's still tongue thrusting. And we had to shorten this arch wire. You see how we did, like, you either get in the center, you got to do 2 of those on the side if you don't, to shorten the arch wire. There's some different things I'll point out as we go along. And we have her wearing some class 2 elastics. That was a little foggy there. Now we're closing that space. And finally, toward the end of this, we went in and put tongue thrust appliances in here to try to break the tongue habit and get her breathing through her nose if we possibly could. If we could get her functioning right, it would work good. Now, about this time, they transferred her to another detention home in another city somewhere, and I don't know where it was, but they took her, and this is as far as I got with her. Let me see, that is right. And so we had her looking pretty good, and from where we started, and if we'd had maybe a few more months or years, we'd get her lined up fairly well. But I don't think I could ever get her wearing a retainer at all. So anyway, this is I'm all stopped up here today. This is a real challenge case, and you may be called on to work on challenged people that are like she's in a detention home. Somebody from that home brought her each time. So I hope she worked out good. I doubt if the young lady ever, got over this whole thing. So I hope for the best. And I'm going to close out here. I didn't take but about 14 minutes here, and I'll hope you'll join our group and subscribe to our video programs, and we're going to try to continue to use these videos to teach people all around over the country and the world. Thank you for watching now, and I'm going to close out.